Millions of people over 50 are taking vitamin D every single day because they've heard it's good for their bones, their immune system, and their overall health. But here's what most people don't realize. Too little vitamin D can cause real problems. Too much vitamin D can also cause serious problems. And without checking your levels, you may have no idea which side you're on. Hey everyone, welcome back. I'm Dr. Kristi Mauldin, your health detective, and if this is your first time here, make sure you check out my links in the description. Today we're going to uncover what vitamin D actually does in your body, 7 warning signs that your level may be off, why more is not always better, and the one blood test that can help guide the conversation with your healthcare provider. Let's get into it. Vitamin D is one of those nutrients that touches almost everything. It helps regulate calcium and phosphorus, and your body depends on it for calcium absorption, bone health, muscle function, immune function, and even nerve function. Now here's the part that matters if you're over 50. As we age, our skin becomes less efficient at producing vitamin D from sunlight. That means even if you're spending time outdoors, your body may not be converting sunlight into vitamin D the way it used to. And that puts older adults at a greater risk for vitamin D inadequacy, sometimes without even knowing it. So who should be paying the closest attention? If you're over 50, that's already a factor. But the risk goes up even more if you spend most of your time indoors, if you have darker skin, or if you're carrying extra weight, because vitamin D is fat soluble and can get stored in fat tissue instead of circulating where your body needs it. Certain health conditions also play a role. If you've been diagnosed with osteoporosis, a malabsorption disorder like Crohn's disease or celiac disease, kidney disease, or liver disease, your vitamin D status deserves extra attention. The same goes if you've had bariatric surgery or if you're taking medications that can affect how your body processes vitamin D. If any of that sounds like you, keep watching, because this next section is where the clues start showing up. Now, I want to be clear, none of these symptoms prove that you have a vitamin D deficiency. Many different conditions can produce similar signs. But when I see these patterns in my patients, vitamin D is one of the first things I want to investigate. Number 1, muscle weakness, especially difficulty climbing stairs, trouble getting out of a chair, or a noticeable loss of leg strength. If everyday movements are getting harder and you can't explain why, that's a clue worth following. Number 2, bone pain, especially in the lower back, the hips, and the legs. This is a deep, aching kind of discomfort that doesn't always respond to the usual remedies. Number 3, persistent fatigue. Not just being tired after a long day. I'm talking about a tiredness that doesn't seem to go away no matter how much rest you get. Number 4, more falls. When muscle performance drops and balance starts to suffer, falls become more frequent, and after 50, falls can have very serious consequences. Number 5, getting sick more often. Vitamin D supports normal immune function, and when levels are low, some people notice they're catching every cold and virus that comes around. Now, I'm not going to tell you vitamin D prevents every infection, but it does play a role in how your immune system responds. Number 6, low mood. There is an association between low vitamin D levels and mood changes. I'm not saying vitamin D cures depression, that would be irresponsible, but it's one more piece of the puzzle worth looking at. Number 7, bone loss. If you've been told you have osteopenia or osteoporosis, or if you've had a fracture from a minor fall, your vitamin D level is something that absolutely needs to be on your radar. Now, here's the part of the conversation that most people skip, and honestly, it's the reason I made this video. Vitamin D toxicity is rare, but it does happen, and it almost always comes from one place: excessive supplementation. Not from sunlight, not from food, from taking too much in supplement form without monitoring your levels. And one of the most common things I see in my practice, leg cramping. Someone was put on vitamin D years ago. They've been taking it faithfully ever since, and nobody ever ordered follow-up blood work to check their levels. They come in complaining about leg cramps, and they have no idea that the very supplement they thought was helping them could be part of the problem. Here's what's happening. Vitamin D dramatically increases calcium absorption. That's one of its primary jobs. But when vitamin D levels become excessive, your body can absorb too much calcium, and that calcium builds up in your blood. This is called hypercalcemia. When calcium balance gets disrupted, it can affect how your muscles function, and that's where those leg cramps come in. But it doesn't stop there. Hypercalcemia can also cause nausea, vomiting, constipation, excessive thirst, excessive urination, muscle weakness, confusion, and fatigue. In more severe cases, it can lead to kidney stones and even kidney damage. The point is this: vitamin D is fat soluble. It doesn't flush out of your body the way water-soluble vitamins do. It accumulates, and very high doses should only be used under medical supervision. I don't care what someone on social media told you. Taking 5,000, 10,000, or 20,000 IU a day without knowing your levels and without a provider guiding you is a gamble, and it's one you don't need to take. So how do you actually find out where you stand? There's a blood test called 25-hydroxyvitamin D. You might see it written as 25-OHD on your lab work. This is the test that physicians generally use to assess your vitamin D status, and it's the number that gives you real information to work with instead of guessing. Now, here's something I want to be upfront about because this is where it can get confusing. Traditional medicine generally focuses on identifying vitamin D deficiency and preventing bone disease. And that's important work. Many functional medicine practitioners, myself included, often prefer to see vitamin D levels higher than the bare minimum needed to avoid deficiency because we believe higher levels may better support overall health. But I want to be honest with you, there is no universal agreement that those higher targets improve outcomes for every single person. Different practitioners may interpret your results differently based on their clinical philosophy and your individual health picture. That's not a weakness in the system. That's why having a provider who looks at you, your symptoms, your history, your lab work matters more than following a one-size-fits-all number. Should everyone take vitamin D? No. Many people benefit from supplementation, but some people don't need high-dose supplements. And some people may already have adequate or even elevated levels without realizing it. The best approach is not guessing. Know your number, then sit down with your healthcare provider and have that conversation based on real data. Get outside safely and let your skin see some sunlight. Eat foods that naturally contain vitamin D. Stay active and focus on maintaining your muscle strength, because strong muscles protect your bones and your balance. If it's appropriate for your health history or if your provider recommends it, consider getting tested. And please stop blindly copying supplement doses from social media. Your body is not the same as the person in that video, and your needs deserve a more thoughtful approach than that. I've been practicing for over 25 years, and one of the biggest mistakes I see is people chasing supplements because someone on the internet said everyone needs them. As a health detective, I want you looking for the root cause, not guessing. Sometimes the answer is vitamin D, sometimes it isn't. That's why your symptoms, your history, and when appropriate, your lab work all matter. If you're watching this and thinking, I want someone to actually look at the whole picture, I'd love to help. Check out the Discovery Call link in the description and let's have that conversation. And if you enjoyed this video, make sure you subscribe because every week we uncover new clues your body may be giving you, and I'll help you understand what they could mean. I'll see you in the next one.